Hey again, it's Kristen with OT from Home. I'm an occupational therapist from South Carolina. And today I want to give you some tips on wrist and forearm range of motion exercises. And as always, they're using items you can find from home. So let's get started. Disclaimer, as usual, if you have had a broken wrist or any sort of injury, please consult a therapist or doctor before beginning these exercises, or please contact me and we can set up a private appointment to get started. All right, so first thing I want to do, paper towel holder. We can use this as a great way to work on some wrist motion. Now you can always prop yourself up over a box or over the edge of the table or a pillow. But what we're going to be doing here is just lowering the wrist all the way down and then lifting the wrist all the way back up. So you've got two basic motions here. You've got wrist flexion and then you've got wrist extension. All right, great. Another way that you can do that, I've just taken the end off of a Swiffer. So this is great. It's also good because this end here is a little bit fatter. So if you're having trouble making a full fist, this is going to give you just a little bit more diameter and make it a little bit easier for you to do these exercises. All right, another way you can do this is to roll. So we're going to go down and then we can roll back. Now you can use a broom handle, you can use a roll of wrapping paper, you can use one of these, you can also use some tin foil. So I'm just giving you lots of ideas for things you can find around your house to do these for yourself or with your patients. So what I've done here is just tied something on the end of a string. This is actually just a little doorknob, little drawer pull, and then we're going to use this roll of wrapping paper. So the thing that the string does is it gives you a little bit of a goal. So sometimes to just sit there and spend something for 5-10 minutes is boring. With something like this, you can work on this, and this would be going all the way to the floor. So you could just drop that down your lap and go all the way down. Once you get all the way down, the string's all the way out. Now you're rolling back up the other direction. So super simple. There's lots of objects in your house that you could achieve that with. All right, let's talk about a few other exercises for the wrist. This is a good one for range of motion, but also for some stabilization. You could use a golf ball. I've got a lime. It's not perfectly round, so it's not going to be smooth, but it's going to work. You can use a frisbee, you can use a plate. So what you're going to do here is you're going to try to just keep this lime or golf ball, tennis ball would work, going right around. And as you can see, it takes a lot of control. And you're still getting some good wrist ulnar and radial deviation and some stability there. All right. So also we want to talk about the forearm. So anytime we're doing forearm exercises, you want to make sure that your elbow is right in on your side, kind of tucked right in at your waist. If your arm's out away from your body, you're getting a lot more motion up here in the shoulder and not truly forearm rotation where these bones rotate over the top of each other. So elbow bent and planted right here on your side. That way you know that you're focusing your motion at the right part of the body. All right, so pair of tongs. You could use sponges. You could use something light. Could use your lime again. But what we're going to do here, elbow right on the side, is if you work on picking up these sponges. So right now, we're in a nice pronated position. We can come to neutral, and then we can go all the way to supination, and you can drop that sponge down. So same thing, you can come back over, and you can work on taking an item from pronation all the way over to supination, or the opposite, picking up in supination and bringing all the way back to pronation. All right, so we've all probably got a pair of tongs, and we've all got some sponges or just something lightweight at the house that you can use to pick up. So that's a great one there. Right. right, got some pineapple juice. You could also do this activity with a soccer ball. You could also use a large bottle, a wine bottle, something like that. So we're just gonna lay it down flat on the table, and I'm actually gonna turn sideways so you can see me just a little bit better. So right here, wrist is in neutral. We're gonna put it right on top. And as we roll forward, you can see as we increase the flexion of the wrist, we're gonna get a really nice stretch there. And then maintaining your fingers, your palm flat on a can as we roll backwards. Now we've got a nice stretch here with the wrist into extension. So you want to keep everything rounded and flat on the container. If not, if you kind of start doing this or you're kind of doing this, you're not really going to get a good stretch. But this is a really great way. And you can see how you could use just any sort of large bottle or ball, and that would work for that exercise. All right, another pronation, supination here. You could grab a roll of tape. Really, you could use anything. We're gonna pretend like this is our wall, okay? So again, elbow right on the side, and we can work on turning all the way up in supination and all the way back down into pronation. All right, so that's a great way to work on that forearm. Same thing, you can just walk right up to a doorknob, all right? Elbow right on the side, and you're gonna work on rotating all the way over and all the way back, okay? Now, be cautious with this. If you've had any sort of surgery, if you've had a fracture, again, please speak with someone, a professional, before doing some of these exercises. A hammer does have a little bit of weight on it, so you want to be careful. If it's a little too much, you can always choke up. If not, you can grab the hammer right here at the bottom, and we're just going to let it stretch us all the way out and then all the way back down, okay? But this isn't something you want to do fresh out of surgery or injury, so as always, consult a professional. Send me a private message. I'm happy to take you as a private client. I am doing virtual patients right now, so please send me a message. Find me on Facebook at Lowe's Therapy. I'm also on Instagram. And as always, please subscribe to my videos and let me know if you like them. Thanks so much.